Is it true that the second trimester is always a walkover among the 3 trimesters in pregnancy? The answer is yes and no, and it depends in each and every individual. To some women, it can be a walkover because actually you're just from the first trimester where you had normal or serious morning sickness, and again, it's different from the third trimester where your belly is also grown and making you uncomfortable. But again, to some women, the challenges continues throughout pregnancy. Welcome to the second trimester, and in this trimester, we're going to discuss the baby's development and the challenges that a mother can experience during the second trimester. Watch to the end.
Welcome to the Nursing Moms. If you like our videos, hit the like button and subscribe. Stay updated for more coming videos by hitting the notification bell.
The second trimester runs from the beginning of week 13 up to week 27 of pregnancy. There's so many changes towards the development of the baby during this trimester, and actually so many body organs start to function during the second trimester. Did you know that it's in the second trimester that your baby is able to hear, to see? Yes, it's in this trimester that the baby is able to identify with the mother's voice. Actually, that's the voice that they love the most. And again, it's in this trimester that you realize the major body organs that were formed in the previous trimester, that is in trimester 1, will have developed much further and are able to function. The major organs that were formed previously in the first trimester, like the kidney, the brain, the heart, always start to function very much better in the second trimester. It's in the second trimester that the heart is able to pump blood. Actually, with a higher faster rate, almost twice your heart rate. Did you also know that in the second trimester, as from week 21, the baby makes the first poo called meconium, but is not able to pass it until he or she is born? It's in this trimester that the baby pees and drinks it. Actually, the amniotic fluid is a sterile urine. The baby pees in it and again drinks. Every mother loves and knows exactly how her baby kicks. Again, it's in this trimester from week 16 onwards, the mother will be able to feel those little kicks or movements. As from week 18 onwards, the reproductive organs in the baby are well formed and can be visible through an ultrasound. So from week 18 onwards, you can be able to know the gender of your baby through an ultrasound. That is an interesting news. The second trimester, there are reflexes that are developed and that needs to be appreciated. One of them is the sucking reflex. Did you know that in the second trimester, your baby is able to suck its fingers? And again, the blinking reflex. Actually, the baby can blink its eyes in the second trimester. Another good reflex is that the swallowing reflex. Yeah, your baby is able to swallow the amniotic fluid and pees it again. Throughout the second trimester, your baby adds an appreciable weight. And again, it's in this trimester that the fingers and the toes are well separated. And if you look at the hands, the palm lines are always there. There are several changes that occur to a woman's body during the second trimester, and these include the growing belly and breast, the Braxton Hicks contractions, the leg cramp, the nozzle problem, the dental problems, the urinary tract infection, the dizziness, the leg cramp, skin changes, among others. We're going to discuss each and every bit of it and how we can handle each and every problem as it comes. Urinary tract infection. Actually, it's in this trimester that the abdomen will be growing, so the uterus will be pressing on the kidney, making it to retain some urine. Urinary retention can lead to urinary tract infection. If you experience any of these symptoms like pain while passing urine, frequency of micturition that you are not able to control, actually you have to go and see the doctor because untreated urinary tract infection can lead to a kidney problem and can as well lead to premature labor. Backache. During the second trimester, the growing uterus can lead to a backache, and again, there is a typical type of pain known as the round ligament pain. For your pelvic to accommodate the growing uterus, there must be loosening of the pelvic joint and ligaments. This leads to a dull or sharp pain around the pelvic area known as the round ligament pain. For you to alleviate this kind of pain, you need a comfortable shoes. You need to keep yourself physically fit by doing light exercise. And again, you need to continue taking your vitamin D supplements and calcium. Again, some backache are just brought by wrong sleeping position. Sleep on your left and use pillows for more comfort. Changes in your skin. You'll realize that in your second trimester, you'll have stretch marks. There's a black line running longitudinally in your abdomen known as the linea nigra. And again, some women experience acne and different types of skin problems. There is less that can be done during the second trimester and you only have to put up with them. The stretch marks occurs due to the increased amniotic fluid and the growing fetus in the uterus, making your abdomen to stretch. Hence, after stretching over skin, it breaks, leading to those silvery, brownish, black marks known as the stretch marks. You only need to oil them, but again, after delivery, your skin will just get back to normal. On this, there is very less that can be done. Dental issues. The pregnancy hormones leads to increased vascularization, especially to the gum areas, making them very, very sensitive to pain and again to bleeding. If you realize that you bleed easily, you just have to keep up with the oral hygiene like flossing and gargling of warm salty water. Again, it's important to visit your dentist because remember, untreated dental infection can lead to premature labor. Leg cramps. Some women experience cramping in the second trimester. If you experience cramping, get yourself a comfortable low shoes. Actually, in the second trimester, try as much as you can to avoid high-heeled shoe if you are a high-heeled lover. Yes, get yourself a low comfortable shoes. Do massage, especially the cramping can always occur on the calf. Massage your calf very well, and you can use warm showers. And again, you have to keep up with the physical activities. And the excess vaginal discharge is also very normal during the second trimester. And if you find yourself often wet, you can use a panty liner to absorb the moisture. The nasal problems. Some women experience nose bleeding or even nasal congestion during the second trimester. The increased level of pregnancy hormone leads to increased vascularization, even in the mucous membranes of your nostrils, making them to bleed easily or being congested, making it difficult for you to breathe. For you to manage this, you need saline drops to ease the congestion. Remember, in the second trimester, your appetite is improving and you are gaining weight. Actually, the average weight to gain is between 2 to 2.5 kilograms per month. But again, there are so many variances that leads to some women gaining less and some gaining more. Continue with your antenatal visits, and again in this trimester the doctor will space your antenatal visits after every 4 weeks. The doctor would want to know how the baby lies, the presentation of the baby, if the fetal heart is okay or not, and again if the fetal movements can be appreciated or not. And again, it's in this trimester you have to continue with your multivitamins in pregnancy, the ferrofolic acid tablets, everything that you used to do in the first trimester, all the vitamin tablets, you have to continue with them in the second trimester. In this trimester, you also have to keep up with your improved eating habits. Yes, just the way you started it in the first trimester, if at all you're able to retain it much in the second trimester, you have to improve on your diet with a lot of veggies and fruits. You also have to keep hydrated in the second trimester. Drink enough of fluids, water, just to keep yourself hydrated. In this trimester, you also have to get yourself enough rest. Sleep as usual for at least 8 hours during the night and have a nap during the day. In the second trimester, you have to keep yourself a bit active. Yeah, you have to do a lot of physical activities that still doesn't strain your body. And again, you have to continue enjoying your sex life in the second trimester, depending on the most comfortable position that you are in. To-do list in the second trimester. Yeah, there's so many changes in your body and you need to do things that will make you adjust or feel comfortable with them. Get yourself a new bra and panties. Actually, your belly is growing and you are outgrowing your previous panties. Get yourself a new set of panties. Another thing you have to get yourself is panty liners. Remember the discharge we talked about in the second trimester. You really need something that will absorb the moisture, and it's important to get yourself the panty liners. If you can, get yourself the pregnancy pillows. Yeah, sleeping might be difficult as time goes by, and you need something that will put you more comfortable. So if you can afford the pregnancy pillows, add it in your to-do list. Thank you for watching this, and I wish you the very best. Let's meet in the third trimester journey.